Tonight in medical rounds, Hartford Hospital is the only hospital in Connecticut to be approved for a new medication to treat brain hemorrhages or bleeding related to the use of certain blood thinners. And joining us live now to explain the benefits of this new drug is Dr. Mark Alberts, Chief of the Ayer Neuroscience Institute at Hartford Hospital and Chief of Neurology at Hartford Hospital. Good evening, Dr. Alberts. Thanks for being with us tonight.
Thank you, Denise.
Well, tell us about Andexxa and what it means.
Right, so this is a new medication just approved by the FDA a few weeks ago, and it stabilizes bleeding in the brain. It stops the bleeding, especially if patients are taking certain of the very new blood thinners that your viewers may be aware of because they're advertised on TV, medicines like Eliquis or Xarelto. Rarely those medicines can cause bleeding in the brain, and Andexxa can stop or stabilize the bleeding, henceforth make the patients relatively stable and prevent them from getting worse.
Boy, it sounds wonderful. I know Hartford Hospital is the only hospital, as I mentioned, in the state approved for this new medication. How did that happen?
Right, so there's an international shortage of the medication because it's very difficult to manufacture. It's hard to produce. So the manufacturers looked around to see which hospitals had the most number of patients who could benefit from Andexxa. And also the hospitals had to have the staff, the physicians, the infrastructure, the pharmacists, and the nurses trained to give the medication. And we're very proud of the fact that Hartford Hospital is so far the first hospital in the state of Connecticut approved and actually having the medication on board.
That's great to hear. And I understand you've already used it. How do those cases work out?
Right, we've used it in almost half a dozen patients, and in the vast majority of those cases, the bleed stabilized, the patients stabilized, and some of them went on to have a good outcome.
Boy,
so we're thrilled to be able to offer this to our patients.
That is great news. And one last quick question. Hartford Healthcare is a partnership with Brown and Yale University. It's participating in a program known as StrokeNet. What does that mean?
Right. This is a National Institutes of Health network of the top facilities in the country. And what we're doing is that we're testing the best therapies to treat stroke, prevent stroke, and improve recovery of stroke. And by partnering with Brown and Yale, we're able to offer our patients the latest and greatest access to the trials that are testing these new therapies.
That's so good to hear. And on a personal note, it's good to hear that there's something now to help treat hemorrhagic strokes. When my dad had one almost 20 years ago, there was very little they can do. So it's very comforting to hear that we've progressed to this point. Thank you so much, Dr. Alberts, for sharing this important information with our viewers. To learn more, you can call the number you see on the screen.